is 9 News Now.
Sailors rely on a compass to navigate uncharted waters. GPS is an invaluable tool keeping drivers from losing their way. Now women facing breast cancer have a guide they can rely on for help. In this morning's Buddy Check 9, a patient navigator adds a human touch to what often feels like a scary and overwhelming process.
Hi, good morning, Carol.
Carol, yeah. I was frightened about the diagnosis. I was confused to some extent about what was going to be expected of me because I knew I'd have several stops along the way before I actually got into surgery. So you go first.
Luckily for breast cancer patient Carol Ann Siciliano, waiting at that first stop on the day of her surgery at Georgetown University Hospital was Carol Wells.
We made an immediate connection. Her name is Carol Ann. My name is Carol Ann. They're going to do the needle localization.
Wells is a patient navigator at Georgetown's Orsman and Nina Hyde Breast Centers. Her place on the day of surgery is right by the patient's side until she goes into the operating room.
If you can make that connection with somebody, then they feel like they have maybe a friend who is there with them, who is really going to be there to help, see that things get done on time, get to point A, point B without any problems.
Hello, good morning. I'm very well. How are you?
I'm fine.
Her freedom with her questions and answers and her general comfort and confidence did a lot to bring me into that surgery with the positive spirit I knew I had to have.
All patient navigators are volunteers. They're not doctors, and they don't pretend to be doctors. They don't offer advice on specific medical treatments. If a patient has a question dealing with a specific treatment, they're immediately referred to the medical experts. Since its inception 2 years ago, program manager Nancy Musick says some 800 patients have used the program.
It's nice. It's as comfortable as a pre-surgical experience can be.
For many women, having surgery on their breasts is a very troubling and scary and a life-altering experience. Carol really brought me around the bend to where I could walk into that operating room with confidence that this was the right thing for me at this time. She'll see him before she sees me.
Yes.
Talk to me.
Yes, exactly. She will indeed.
Yeah, that's good.
If you'd like to arrange to use the patient navigator services, or if you'd like to be a volunteer, we're providing a link to the Orsman Patient Navigator program at WUSA9.com. You can also click on our new breast self-exam video there, plus get a link to my blog where you can read my colleague Amy Leone's column. Amy is training for the Komen 3-Day. That happens in October. We'll follow her progress every step of the way as she prepares for the 60-mile race, and it's a good preparation for those of you who are going to be taking part in the June 7th Komen Race for the Cure. And if you forgot yesterday was the night, don't forget to call your buddy and share all of this information with her. Mike?
The George Washington University gymnastics team hosted its first annual